you know, you can always do better. Whatever you do, you can always learn more because there are always people around that know more than you do. And you might not become like them, but you become better than you were a year ago.
Hey guys, welcome to the CPD Junkie podcast, where we bring you interviews with dentists sharing their CPD stories and journeys from around Australia. I'm your host, Lawrence Doan, and tonight we are joined by Dr. Leo Lander. Dr. Leo Lander has been practicing dentistry overseas for a decade. The last 2 years was being in oral maxillofacial surgery before relocating to the Southern Hemisphere. Then he moved to Dunedin, New Zealand in the early 2014 to undertake specialist training at the University of Otago in the field of Periodontology. Upon graduation in 2016, Leo has been practicing the full scope of Periodontics and Implantology in Adelaide, South Australia. Dr. Leo Lander, welcome to the show.
Hello.
So, you specialize in perio, but that wasn't always the case. So, tell us about your CPD journey so far.
Well, to be honest, when I was a dental student, I always thought that I'm not going to specialize. So, because I thought it would kind of limit my scope of practice. And I never actually had fun doing perio at the dental school, and I actually loved endo. But things change, people change. Right now, I would rather poke myself in the eye with a K-file than do an endo. And I love what endodontists do. They preserve people's teeth until they can save up for the implant. But we change, we evolve. So when I was doing my dental school, I was on a military scholarship. So I had to give some of the time back to the military. So after graduating, I was an army dentist for a while, which was interesting. I mean, you're kind of, I was stationed for like 3 years in infantry base. So you kind of learn to operate on your own and kind of try stuff that you probably wouldn't try if you had support, but you don't have it. So kind of similar to being like really, really rural in Australian terms. And then I got accepted into next step training program. But after doing 2 years of